The trauma bay doors slammed open at 2:47 in the morning, and the soldier on that gurney was already turning gray. His skin had gone the color of old ash. His chest was barely moving. 3 doctors surrounded him, and not one of them knew what they were looking at. But she did. The quiet nurse standing in the corner, the one everyone ignored, the one the chief surgeon called a liability to his face. She took one look at that soldier's eyes and recognized the chemical compound before the military briefing even hit the fax machine. Nobody knew what she used to be. They were about to find out. Before we go any further, if this is your first time here, hit that subscribe button right now and turn on your notifications, because the stories on this channel do not slow down. Every single week, we bring you something that will keep you up at night. Hit the like button if you're already hooked, and drop a comment below telling me what city or country you're watching from. I want to see exactly how far this story has traveled. Now, let's get into it. The night shift at Hargrove Military Medical Center had a rhythm to it that most people mistook for peace. It wasn't peace. It was exhaustion wearing peace as a costume. By 2 in the morning, the fluorescent lights in the East Wing corridors had started their familiar flicker. The maintenance request had been sitting in the system for 11 days. And the hallways smelled like antiseptic and bad coffee, and the particular kind of quiet that only exists when everyone is too tired to speak. Nurses moved between rooms with the practiced economy of people who had learned not to waste a single motion. Monitors beeped. Somewhere down the hall, a patient's call light had been blinking for 4 minutes without anyone responding because the floor was down 2 staff members and the charge nurse was handling a blood pressure emergency in room 14. Nora Voss noticed the call light. She always noticed the things other people decided not to see. She was 36 years old, medium height, with dark hair she kept pulled back in a braid that was practical rather than pretty. She had the kind of face that people forgot immediately after meeting her, not because there was anything wrong with it, but because she never drew attention to herself in the way that made faces stick in memory. She wore her scrubs plain. She didn't wear jewelry. She kept her voice low and her opinions lower, at least in the places where opinions got people in trouble. She had been at Hargrove for 2 years. In those 2 years, she had learned exactly who to avoid and exactly how much invisible work it took to keep a hospital floor functioning when the people in charge were more interested in protecting their own reputations than in running a safe unit. She had filed 3 incident reports that quietly disappeared. She had covered for colleagues who were drowning without ever being asked. She had stayed 4 hours past the end of her shift on a Tuesday in March because a post-surgical patient had coded and the team was short-handed and leaving felt like abandonment. Nobody thanked her for any of it. That was fine. She hadn't done it for thanks. She ducked into room 7, reset the call light, adjusted the blanket on the elderly veteran lying in the bed who had simply wanted a glass of water and couldn't reach the pitcher on his own. She poured it for him. She made sure he could reach it. She straightened the IV line that had started to pull at an angle that would leave a bruise by morning. "You're the only one who actually checks," the old man said. "Drink your water, Mr. Aldridge." He laughed a little, which made him cough, and she waited until the cough passed, and then she slipped back out into the hallway. Dr. Callum Reach was standing at the nurse's station when she returned, arms crossed, wearing the particular expression that meant he had been looking for something to be irritated about and had recently found it. Callum Reach was 49 years old and the director of surgical services at Hargrove. He had the kind of institutional authority that came not from being the most skilled person in the room, but from having been in the room the longest, from knowing whose name was on which committee, from understanding that medical hierarchies were social structures as much as professional ones, and from being comfortable, genuinely, peacefully comfortable, with using that knowledge to keep people below him exactly where he needed them to stay. He was not a bad surgeon. He was a mediocre one who had learned to surround himself with people who made him look better, and to undermine the ones who might make him look worse. He looked at Nora the way he always looked at her, like she was furniture he hadn't gotten around to replacing. "Voss?" "Dr. Reach." I pulled the incident log from last Thursday. He set a printed sheet on the counter between them. "You flagged a contraindication on Kowalski's post-op orders." "Yes." "Dr. Pemberton's orders." "Yes." "You went around him to the attending." Nora kept her voice neutral. "The patient had a documented penicillin allergy. The order was for ampicillin. I flagged it through the correct channel before the medication was administered. The correct channel is to bring your concern to the ordering physician first. I did. He told me I was misreading the chart. And yet you still escalated. She met his eyes. The patient didn't receive a medication she was allergic to. Reach picked up the incident report, held it for a moment like he was considering it, and then set it back down. You're here to carry out orders, Voss, not audit them. If every nurse on this floor decided to second-guess attending physicians, we'd have chaos. Or fewer adverse events. His expression didn't change, but something behind his eyes did. This is your second formal conversation this quarter about exceeding your scope of practice. I prevented an allergic reaction. You created conflict in the care team. He tapped the paper. I'm adding this to your file. I'd encourage you to think carefully about what your role here actually is. He walked away without waiting for her response, which was the kind of move designed to make clear that her response didn't matter. Nora stood at the nurse's station for a moment after he left. She breathed slowly. In through the nose, out through the mouth. A technique she had learned a long time ago for circumstances considerably more dangerous than this one. Then she went back to work. The night continued the way nights continued, not in dramatic waves, but in the accumulation of small things. A dressing change in room 3. A family member who had snuck past visiting hours and needed to be gently redirected. A medication reconciliation that took 40 minutes because the patient had seen 4 different specialists and nobody had bothered to cross-reference the list. Nora worked through all of it with the steady, methodical focus that her colleagues sometimes mistook for detachment. It wasn't detachment. It was discipline. There was a difference, though she'd stopped explaining it to people who weren't interested in understanding it. Around 4 in the morning, she was in the break room heating up coffee that had been sitting in the pot since midnight when Danny Reyes came in looking for something to eat that wasn't vending machine crackers. Danny was 28, a travel nurse in her 3rd month at Hargrove, still in the phase where she was trying to figure out how the social architecture of the floor worked. She had taken to following Nora's lead in small, unconscious ways, positioning herself nearby during handoffs, asking Nora's opinion on things she technically didn't need another nurse's opinion on. Reach got to you again, Danny said, reading something in Nora's posture. Routine. What'd you do this time? Kept a patient from getting a medication she was allergic to. Danny sat down on the edge of the break room counter. That's insane. It's not insane. It's a system that prioritizes hierarchy over outcomes. Nora wrapped both hands around the coffee mug, which means you navigate the hierarchy carefully if you want to actually affect outcomes. So you just take it. I don't take it. I file reports, I document, and I do my job without letting someone's ego interfere with patient care. Danny was quiet for a moment. Pemberton told me last week that floor nurses shouldn't use clinical judgment. That's what attendings are for. Pemberton also once left a lap sponge in a patient during a routine cholecystectomy, which is in the public record if you want to look it up. Danny stared at her. Why do you know that? I research the people I work with. That's... The overhead speaker interrupted her. Trauma activation. Bravo protocol. All available trauma personnel report to Bay 1 immediately. This is not a drill. Bravo protocol was the designation that Hargrove used for military mass casualty events, specifically for situations where the patients arriving were active military personnel and the incident involved classified circumstances that required a separate chain of command operating alongside the standard medical response. Nora had heard the designation once before, in a different hospital, in a different life. She set down her coffee and moved. Bay 1 was already controlled chaos by the time she arrived. The ambulance bay doors were open to the night air, and through them she could see the rotating lights of 2 vehicles and something else. A dark helicopter on the hospital's landing pad, military markings, blades still decelerating. The crew was moving fast and without the particular kind of urgency that meant everything was under control. They had the urgent efficiency of people operating in crisis who were trying very hard not to show it. The patient came through the doors on a gurney pushed by 2 men in tactical clothing, not paramedics. Both of them had the physical bearing and the controlled expression that Nora recognized from a context she had spent 2 years trying not to think about. The patient was male, mid-30s, with the build of someone who trained for function rather than appearance. He was strapped to a backboard, an oxygen mask already in place, and even from 10 feet away she could see that his color was wrong. A grayish undertone beneath the natural warmth of his skin that had nothing to do with lighting. His left hand was shaking with a fine, rhythmic tremor that wasn't voluntary. His eyes were open but tracking slowly, like a camera trying to find focus. She read him in 3 seconds. The pupil on the left was slightly larger than the right. Unequal dilation, mild but present. The skin around his neck and collar showed faint erythema. Not a rash exactly, more like a flush that had started and then couldn't decide what it was doing. The tremor in the hand was specific, not gross motor shaking, but something finer, something that started in the smaller muscle groups. She knew what she was looking at. The knowledge arrived not as a thought, but as a physical recognition. Her body processing the information faster than language could catch up. The same way her body still sometimes woke her up at 3 a.m. with her hand reaching for something that wasn't there. Dr. Reach arrived at the bay 30 seconds behind her, already issuing instructions. Get me a full panel, CBC, CMP, tox screen. Start 2 large-bore IVs. I need portable imaging in here now. The nurse at the cart began pulling supplies. The attending on call, a woman named Dr. Sandra Pruitt, who Nora had always found competent, if cautious, was on the other side of the gurney calling out vital signs as the monitoring equipment connected. BP 86/54, heart rate 112, O2 sat 91 on 15 liters. Push fluids, Reach said. Get me the tox report as soon as the blood pulls. Nora was standing at the foot of the gurney. She was watching the patient's chest rise and fall, watching the quality of the breathing, not just the rate. There was a slight paradoxical movement, the chest and abdomen working against each other in a way that was subtle but visible if you knew what to look for. She stepped forward. The tox screen won't show it. Reach didn't look up. I didn't ask for commentary. He's showing organophosphate toxicity, the pupil asymmetry, the tremor pattern, the skin response. This is chemical exposure, not standard trauma. Voss. His voice dropped, sharpened. Back up. The treatment window for nerve agent exposure is narrow. If we're waiting for a standard tox panel, I said back up. He turned to look at her now, and his expression had moved past irritation into something more deliberate. You are a floor nurse in a trauma bay. Take 1 step back, or I will have you removed. Nora held her position for exactly 1 second. Then she stepped back. But she didn't look away from the patient. She kept watching the tremor, watching the way his breathing was beginning to shift, the paradoxical movement getting marginally more pronounced. A change that would be easy to miss if you weren't specifically looking for it. She looked at Danny, who had followed her in and was now standing near the supply cart, with the expression of someone watching a car accident unfold slowly enough to see every detail. Nora said quietly, pull the atropine, both concentrations, and pralidoxime. We're not... Just have it ready. Danny looked at her for a moment. Then she started pulling supplies. Reach was still working through his standard protocol, ordering imaging, calling for the portable chest X-ray, managing the room the way he managed every room, with authority that came from position rather than knowledge. Pruitt was doing her best, following the protocol, doing what the protocol said to do when you didn't know what you were dealing with. The problem was, the protocol assumed a known quantity. The 2 men in tactical clothing who had brought the patient in were standing near the bay doors. They had not left. They were watching the medical team with the particular attentiveness of people who were waiting for something to go wrong, and Nora had the sense that something in their stillness was tipping over from waiting into urgency. One of them, older, with close-cropped gray hair and the posture of someone who had spent decades carrying rank, caught her eye. She looked at him. He looked at her. He looked at the patient, looked back at her, and something shifted in his expression. Not quite recognition, more like a man doing rapid arithmetic and arriving at an answer that surprised him. He walked over to where she was standing. You see it, he said. It wasn't a question. Yes. What do you need? Atropine, 2 milligrams IV push, every 5 to 10 minutes until secretions dry and breathing stabilizes. Pralidoxim, 1 to 2 grams over 15 to 30 minutes. And I need reach to get out of the way. The man's jaw tightened slightly. He glanced across the bay at Reach, who was still running his standard workup with the focused efficiency of someone who is very competent at handling the wrong problem. That's not going to happen easily. No, Nora agreed. It's not. At the gurney, the patient's oxygen saturation had dropped to 88. Pruitt said it aloud, her voice carrying the controlled tension of someone who was starting to realize that the tools she had were not matching the problem in front of her. O2 sats dropping, 88, 87. Reach ordered a breathing treatment, ordered a repeat blood pressure, kept working. The patient's left hand had stopped tremoring and gone still, which was not an improvement. Stillness in that context meant the voluntary muscle response was beginning to fail. Nora did not hesitate. She moved to the medication cart, took the atropine that Danny had pulled, and walked to the IV access site on the patient's right arm. Voss, Reach's voice cut across the room. Do not touch that line. He's going to arrest. That is not your call to make. 2 milligrams atropine IV push. She said it clearly, loudly enough for everyone in the room to hear. For the record, for the nurses who were watching, for Pruitt, who had gone very still on the other side of the gurney. Organophosphate toxicity, chemical exposure. The tox panel won't flag it because it's not a standard compound. Remove her from this bay right now. Reach pointed at the nurse nearest the door. Somebody get security. Let her work. The voice came from the gray-haired man in tactical clothing. It was a quiet voice, not loud, not aggressive, the kind of voice that had learned it didn't need volume to carry weight. Reach turned. This is a medical facility and you do not have authority here. Lieutenant Colonel Warren Steck, Defense Intelligence Agency. The man's hand moved to the inside pocket of his jacket and produced credentials that he held up long enough for Reach to read. The patient is a federal asset under active DIA jurisdiction. His treatment falls under Executive Protocol 7, which gives operational medical personnel priority authority in cases of classified chemical exposure. He looked at Reach with the kind of patience that had run out several minutes ago and was now simply holding its shape out of discipline. Step back, doctor. Reach's face had gone a specific shade of pale. He stepped back. Nora was already at the line. 2 milligrams atropine IV push, she said again, and administered it, and then looked at the clock on the wall and counted, the way she had counted 100 times before in places where the walls were not white and the light was not fluorescent, and the weight of getting it wrong was something you carried in your body for years afterward. The room was very quiet. Everyone watching. Pruitt was watching the monitors. The O2 sat held at 87. Stayed there. Then 88, 89. The patient's chest rose with a quality that hadn't been there before. Fuller, less labored, the paradoxical movement beginning to resolve. 91. 92. Danny exhaled audibly from somewhere near the cart. Nora kept her eyes on the patient, kept counting, waiting for the atropine to reach its full effect, watching for the signs that would tell her whether the first dose was enough or whether she was about to administer a second. The patient's eyes moved. For the first time since he'd come through the doors, he was actually tracking, focusing, seeing, his gaze moving from the ceiling to the lights to the faces around him with the slow, effortful deliberateness of someone swimming up from a very deep place. He found her face. He looked at her for a moment with the expression of someone who was too disoriented to be certain of anything. Then his mouth moved. No sound came out, but she could read it clearly. What happened? Chemical exposure, she said quietly. You're going to be okay. Stay still. He didn't look away from her. Something shifted in his expression, something that went past disorientation into something else, something she couldn't quite read, like a man recognizing a voice he couldn't place. Behind her, she heard Reach say something to one of the other physicians, his voice low and clipped, and she knew, without needing to look, that this was not over. That whatever was happening in the next 5 minutes was only the leading edge of what was coming. She also knew, from the way Colonel Steck was watching her from across the room with that expression of careful arithmetic, that the stabilization of the patient was the smallest of the things that had just shifted in this building. The patient's O2 sat climbed to 94. His hand moved, the same left hand that had been tremoring, that had gone dangerously still. And it moved with purpose this time. Not involuntary tremor, but deliberate, reaching toward her forearm and closing around it with a grip that was weaker than it should have been, but was there. She looked down at his hand, looked back at his face. His eyes were clearer now, focused. And there was something in them. Not just gratitude, not just disorientation, something that looked, impossibly, like recognition. Colonel Steck crossed the room in 4 strides and stopped directly beside her. He looked at the patient, looked at her. "What's your name?" he said. Not to the room, specifically to her. She kept her eyes on the patient. "Voss. Nora Voss." A pause. "That's not what I asked." She felt the room shift slightly. Not physically, but in the way that pressure shifts before a storm. Some change in the quality of the air that everyone in the room registered without being able to name it. She had spent 2 years building the architecture of this identity. 2 years of keeping her voice low, her history quiet, her skills visible only in ways that didn't draw the specific kind of attention she was standing in right now. 2 years of telling herself that the woman she had been was separate from the woman she had become, that the distance between those two people was protective and real and permanent. The patient's grip on her arm tightened slightly. He was watching her, waiting. Something in his face said he already knew the answer. Colonel Steck said it very quietly, in a way that was meant only for her, except that the bay had gone so silent in the wake of everything that had just happened that it carried to every corner of the room. "Ghost Actual, is that you?" The words landed like a stone dropped into still water. And in the silence that followed, as every person in that trauma bay turned to look at her, Nora Voss stood completely still and felt 2 years of careful, deliberate distance collapse in the span of a single breath. She didn't answer him right away. That was the answer. In the silence that followed Steck's question, something happened in the trauma bay that had nothing to do with the patient stabilizing on the gurney or the monitors climbing toward numbers that indicated survival. It was subtler than that and more significant. The particular quality of stillness that descends on a room when the people in it understand, collectively and without being told, that the ground beneath the situation has just shifted and they are not yet sure which way everything is going to fall. Nora kept her eyes on the patient. His grip on her forearm hadn't loosened. It was still weak. She could feel the effort it was costing him just to maintain it, could feel the fine tremor that hadn't fully resolved working through his fingers. But it was intentional, and the intentionality of it was doing something to her that she didn't have the capacity to process in this moment. So she set it aside the way she had learned to set things aside. In the locked and carefully organized interior space she'd built over 2 years of deliberate distance. 94 is good, she said to Pruitt. We need the pralidoxime running within the next 10 minutes. 1 gram over 15 with a second gram ready if the tremor doesn't resolve. Pruitt looked at her, looked at Steck, made the calculation that people make when institutional authority and actual competence are pointing in different directions, and the patient in front of them is the consequence of getting that calculation wrong. Get the pralidoxime from pharmacy, Pruitt said to the nearest tech. Now. From across the room, Reach said nothing. He was standing near the far wall with his arms crossed, and the expression on his face was the expression of a man who is recalibrating. Not the situation, not his understanding of what had happened medically, but specifically his exposure. How much had he said? Who had heard it? What the formal record currently reflected? Nora knew that expression. She had seen it on men with institutional authority their entire careers when something happened that their authority hadn't predicted and couldn't contain. They didn't worry about being wrong. They worried about being on record as wrong. Steck took a half step closer to her. I need a name, he said quietly. You have a name. I have the name on your badge. I need the other one. She finally looked at him. He was mid-50s, close-cropped gray hair that had probably been dark once, a face that had been weathered by enough years in enough places that it had settled into a permanent kind of neutral that was harder to read than an actual expression. He wasn't threatening, he wasn't performing. He was simply a man who had done this long enough to understand that certain questions couldn't wait for comfortable timing. "Calloway," she said, quietly enough that only he could hear it. "Nora Calloway. Before." He absorbed that. Didn't react to it outwardly, just absorbed it the way you absorbed information when you'd trained yourself to receive it without the distortion of response. "I thought you were dead," he said. "I know. A lot of people thought you were dead. That was the point." The patient's monitor beeped twice in a pattern that pulled her attention back immediately. O2 sat had climbed to 95, which was good, but the heart rate had ticked up. 118, 120, which meant the atropine was doing what atropine did, and they needed to watch the rhythm. She reached across and adjusted the monitoring settings, added a second parameter to track, and did it with the automatic efficiency of someone whose hands knew where to go before her brain finished forming the instruction. The patient was watching her. He had been watching her since he'd been able to focus, and there was something in his attention that was heavier than gratitude. She still couldn't name it. She set it aside again. "What's his name?" she asked Steck. "Reardon. Captain Marcus Reardon." The name meant nothing to her, which meant he had come up after she left, which meant he was operating in the structure she had walked away from without ever knowing she had existed in it. That was both simpler and more complicated than if she had known him. "What was the exposure?" Steck hesitated. "Colonel," she said, and the word came out with a weight it wouldn't have had if she'd said it 10 minutes ago, a different quality of authority, and something shifted in his posture in response to it. "What compound?" "Modified VX derivative. They're calling it variant 7. It's been through synthesis modifications we haven't seen before. Standard nerve agent protocols get you partway there, but the timing windows are compressed." "How compressed?" "Based on what we saw in the field, you've got about a third of the standard response window before irreversible neuromuscular damage." She processed this, did the mental arithmetic. "Then the first atropine administration should have happened 12 minutes ago." "Yes. And the reason it didn't is standing against your far wall with his arms crossed." She looked over at Reach, looked back at Reardon, looked at the clock. "The pralidoxime needs to go in now," she said, "and I need the room quiet." The next 40 minutes had the quality of time passing differently than normal time, compressed in some places, stretched in others, the way it always did when you were inside a situation that demanded your complete attention and your body understood that this was one of those periods where mistakes were not recoverable. Nora moved through the protocols with a focused efficiency that she had not used in 2 years, and the efficiency came back without effort, which was the thing about certain kinds of training. It didn't fade, it just went dormant, and dormancy and absence were nothing alike. The pralidoxime went in. Reardon's tremors gradually resolved, starting in the larger muscle groups and working outward, which was the right direction. His blood pressure climbed, 86 to 94 to 102. Still low, but moving. His O2 sat stabilized at 96, and his breathing, which had been carrying that worrying paradoxical quality, smoothed into something functional, if not quite normal. He was not out of danger, but he was no longer actively dying. Pruitt worked alongside her without friction once the framework was clear. She was that kind of doctor, Nora had observed over 2 years, competent and adaptive, limited mainly by a tendency to defer to whatever the loudest voice in the room demanded. With Reach sidelined and Steck providing the authority structure, Pruitt's actual capability showed up in a way it usually didn't, and it was better than Nora had expected. Reach stayed against the wall. He didn't leave. She noticed that. He could have left. He chose to stay, which meant he was watching, building his version of events, identifying the places where he could reframe what had happened as something other than what it was. She noticed that and filed it. When Reardon's vitals had stabilized enough to move toward the ICU, Steck caught her arm just outside the bay doors. "We need to talk." "You need to let your man get to the ICU first. You can make time afterward." She looked at him. "I'm still on shift." "Nora." He said it differently this time. Not the tactical address of 2 minutes ago, but something more personal, and it was the personal quality of it that told her this conversation was not going to be containable to the logistics of the night. "I'm not here to pull you back. I'm not here on recruitment. I need you to understand something about why Reardon was on that mission and what's attached to it because it affects what happens in the next 24 hours in this building." She was quiet for a moment. 15 minutes, she said. "After he's transferred." "But what?" The staff lounge on the fourth floor was empty at that hour. Steck closed the door. He didn't sit. Reardon was running an intelligence extraction mission inside a production facility in the Gulf region, he said. The facility is manufacturing Variant 7 for distribution. What he was pulling, the synthesis documentation, the distribution network, the funding chain, is the kind of material that ends programs permanently. He paused. He was extracted early when the exposure happened. We got him out, but the documentation is still there, and we have a 72-hour window before the facility relocates. What does that have to do with me? Reardon's team lead. The mission's operational now without a medical officer who understands the compound. We lost our medical specialist in the extraction. He met her eyes directly. You know Variant 7. You just demonstrated that about as clearly as it can be demonstrated. There are military medical officers who have never seen this compound, who would be working from a briefing sheet versus actual experience, and who would need 3 days of preparation time we don't have. He pulled a chair out from the table and sat on the edge of it, which she recognized as a gesture meant to make the space feel less formal. I'm not asking you to come back. I'm asking you to consult. 48 hours. You'd be behind the forward element, not inside it. Medical advisory only. She stood at the window. The hospital campus below was quiet. Parking lot lights, an ambulance sitting empty outside the bay, a maintenance truck making slow circuits around the perimeter. You said you weren't here for recruitment. I'm not. I'm here because a man who would have died tonight didn't, and because the thing that made the difference was experience you have and nobody else in the DIA's medical roster currently has. He was quiet for a second. I'm not going to pretend I don't need it. She didn't answer immediately. She was thinking about something that had nothing to do with the mission and everything to do with what had happened in that trauma bay when she'd administered the first atropine push. The way the room had shifted, the way Danny had watched her from across the cart with an expression that was reassessing everything she thought she knew. The way Reach's face had done what it had done. The way the last 2 years of careful, deliberate invisibility had come apart in 40 minutes. Who knows, she said, about Calloway. Right now, me, Riordan, and whoever he told between the exposure and losing consciousness, which I'd guess is no one because Riordan doesn't talk when he's operational. Steck laced his hands together. The record in this facility will show a DIA jurisdiction override and a nurse named Nora Voss who administered correct treatment for a classified chemical exposure. That's all. Is that all? He understood what she was asking. The name Calloway doesn't need to appear anywhere in this building. She turned from the window. Let me think about the consultation, she said. The immediate answer is no. Ask me again in 8 hours. He nodded. Fair. She left him there and went back to finish her shift. By 6 in the morning, the night had resolved into the gray early light that came through the east wing windows and made everything look both more and less real than it had in the dark. Nora completed her documentation, gave handoff to the day shift nurse, and was standing at her locker pulling on her jacket when Danny appeared in the doorway of the locker room. She looked like she'd been awake for the entire shift without the benefit of adrenaline to carry her through the last 2 hours of it. Hey, Danny said. Hey. You okay? I'm fine. Danny leaned against the doorframe. She was quiet for a moment in the way of someone who had a specific thing to say and was deciding how to say it. I've worked in 4 hospitals. ER, surgical, trauma. I've seen a lot of nurses. Another pause. I've never seen anyone move like that. Nora closed her locker. You were trained somewhere, Danny said. Before this? Somewhere that wasn't nursing school. I did a lot of continuing education. That's not what Danny stopped. Okay, yeah. Okay, you don't have to. She stopped again. I just want you to know that whatever that was, I'm not going to say anything about it, to anyone. Nora looked at her for a moment. The atropine, she said, that you pulled before I asked. Yeah? Good instinct. Danny nodded. Something passed across her face that was close to relief. I'll see you Thursday. She left. Nora stood in the empty locker room for a moment, alone. She was tired in a specific way she hadn't been tired in a long time. Not the standard fatigue of a night shift, but the particular bone-level exhaustion that came from operating at a ceiling you'd been carefully avoiding for 2 years. She knew this kind of tired. It came from the muscle memory of intensity, from the cost of suppression giving way to output. She was also, underneath the tiredness, something she was less comfortable naming. Not alive, exactly. That was too easy, but something adjacent to it. The particular quality of functioning at full capacity that she had told herself she didn't need anymore, that she had deliberately traded away for the quieter version of usefulness she'd been living in. She pushed through the locker room door into the hallway. Reach was standing in the corridor. She hadn't expected that. She'd expected a phone call, a formal meeting request, something with the institutional machinery of distance and paperwork. Not him, in person, in the corridor outside the locker room at 6:15 in the morning. He looked like he hadn't slept, which was probably accurate. He also looked like a man who had spent the last several hours in the uncomfortable process of deciding how to have a conversation he hadn't anticipated having. "I owe you an explanation," he said. "You owe the patient his life. I'm not interested in the explanation. Voss, I have documentation supporting the clinical decisions I made. Colonel Steck's jurisdiction override is on record. You're protected procedurally, Dr. Reach, and so is the hospital. That's what you're worried about." His jaw tightened. "That's not—" "Go home," she said. "Get some sleep. I'll see you on my next shift." She walked past him. She was 20 feet down the hallway when his voice came after her, quieter than she expected, with less performance and more plain human discomfort. "How did you know?" She didn't stop walking. "I've seen it before," she said, and pushed through the stairwell door and let it close behind her. She got 4 hours of sleep, which was 2 fewer than she needed, and 3 more than she'd gotten in similar circumstances in a previous life. She woke to 2 missed calls from a number she didn't recognize, DIA routing based on the prefix, and a text from the same number that said only, "Reardon is stable. Asked about you." She stared at that text for a long time. Then she made coffee and stood at the window of her apartment and looked at the street below, where morning was doing what morning did. The ordinary rhythm of people going places, the kind of life she had chosen 2 years ago when the alternative had become something she couldn't continue to be. Her phone rang again. This time she answered it. "I thought about the consultation," she said. "And?" Steck's voice was neutral, the way it had been in the hospital. "The answer is still no." She paused. "But I want to see Reardon. He's in the ICU. DIA has a security perimeter. I know where the ICU is." A pause. "When?" "This afternoon." She hung up and finished her coffee. The ICU at Hargrove was on the 3rd floor, and DIA security had it configured in the specific, visible way that federal operations configured hospital security when they wanted people to understand that access was controlled without necessarily announcing why. 2 men outside the unit entrance, not in tactical clothing now, but in the anonymous business casual that federal personnel wore when they were trying to look like medical administration and not quite succeeding. They let her through without asking for her badge. Steck had been there. She didn't ask. Reardon was in the 3rd bay, separated from the others by a curtain that had been drawn fully around the space. His vitals were better. The monitors told her that before she opened the curtain. 97 on room air. Heart rate 72. Blood pressure 110/68, which was on the lower side of normal but stable and trending upward. He was awake. He was also less pale than he'd been at 3 a.m., which in the context of where he'd been at 3 a.m. was significant enough that she noted it without comment. He was sitting up about 30 degrees, which ICU nurses generally tried to maintain anyway, and he was looking at the curtain as she opened it with the expression of a man who'd been told someone was coming and had been waiting with the careful stillness of someone trained to make waiting look effortless. It wasn't quite effortless. There was a tension around his eyes that the stillness of the rest of him didn't fully cover. "You're the nurse," he said. "I'm a nurse," she said. "Steck says your name is Voss." "It is." He watched her pull the chair from the corner of the bay and sit down, not at his bedside in the deferential position, but at the foot of it, where she could see both his face and the monitors simultaneously. Old habit. He also says there's another name, Reardon said. Steck talks too much. Something shifted in his expression that might have been the beginning of a smile. He said that too, actually. He was quiet for a moment. I remembered something before I lost consciousness in the field, before the team got to me. I was having, it sounds strange, hypoxic cognition, she said. The exposure affects the neural pathways before the motor responses fail, lucid intervals that feel disproportionately clear. He looked at her with that same quality of attention he'd had in the trauma bay. In one of those intervals, I thought I recognized you. You don't know me. No, but I was briefed on Ghost Actual 3 years ago, the mission record, the medical reports from Sector 9. He paused. I read them twice because they didn't make sense. The things that field medic did in those circumstances were a long time ago. They were enough that I had them memorized. He studied her face. The hands, he said, in the trauma bay. The way you moved at the line. I was mostly gone, but I was still... He stopped. It was the same movement pattern, from the debrief photographs. Nora said nothing. Are you going to tell me I'm wrong? She looked at the monitors, looked back at him. How are you feeling? He laughed, which made him wince slightly. That's a yes. It's a, your heart rate is still elevated and you need to stay calm. He looked at the ceiling for a moment. Steck wants you for the consultation. I know what Steck wants. The documentation Reardon's team left behind, he caught himself, corrected it. The documentation my team left behind. If it doesn't come out in the next 72 hours, it doesn't come out. There are people in 4 countries who will spend the next decade building Variant 7 into something worse than what you stopped last night. He turned his head to look at her directly. You don't have to go back to what you were, but you know things that matter right now, in this specific window. She was quiet. I know the pitch, she said. I'm not pitching you. I'm telling you the actual thing because you're the kind of person who can hear the actual thing. He held her gaze. And because you already know what you're going to decide. The monitor beeped once in the silence that followed. She stood up, pushed the chair back to the corner. Get some sleep, Captain. She left the bay and walked back through the ICU toward the exit, and she was halfway down the corridor when her phone buzzed in her pocket. She stopped, pulled it out. The text was from a number she didn't recognize. Not the DIA routing prefix, not anyone in her contacts. The message was 4 words. We know who you are. She read it twice. Stood very still in the middle of the ICU corridor with the monitors beeping softly behind her and the ordinary sounds of a hospital floor moving around her. Then she looked up and down the corridor. Then she looked at the text again. Her pulse had not changed. That was the thing about certain kinds of training. Your body knew the difference between fear and information, and it chose the response appropriate to what the moment actually required. The text was information. The appropriate response was not panic. It was to understand, immediately and with the clarity of someone who had operated in these conditions before, that the window for anonymity had just closed in a way that had nothing to do with Steck and nothing to do with the trauma bay, and everything to do with forces she hadn't accounted for. Someone had been watching the hospital, someone who knew enough to know what the trauma bay event meant, who had the technical capability to run a phone trace in under 12 hours, who had her current number from a source she couldn't immediately identify. She pocketed the phone, walked to the elevator, pressed the button for the ground floor, and stood in the elevator with her back to the wall and her eyes on the doors and her mind moving through the architecture of what she knew and what she didn't know, and what the gap between those two things was going to cost. The elevator opened. Reach was standing in the lobby. He was not alone. The man beside him was someone she had never seen before, early 50s, expensive coat, the particular groomed confidence of someone who moved through institutions without being subject to their rules. He was looking at her with a familiarity that made no sense, with the calm, measuring expression of someone who had known she was coming out of that elevator before she stepped into it. Reach's expression was the one she'd learned to read in the 6 months she'd worked under him, the one that meant he had just made a calculation and had not yet decided whether it was the right one. Voss, he said, there's someone here who'd like to speak with you. The man in the expensive coat extended his hand. "My name is Aldrich Morrow," he said. "I work for the people who made the compound your patient was exposed to." She did not take his hand. Aldrich Morrow held it out for 2 full seconds before he let it drop, and he did it without embarrassment, which told her something about how often he operated in situations where the normal social conventions had already been suspended. He was the kind of man who expected rejection as a data point rather than an insult. "I know this is unexpected," he said. "Is it? We should find somewhere private to talk." She looked at Reach. He was doing the thing she'd watched him do in the trauma bay, managing his expression to project authority while internally running calculations about exposure and consequence. He looked like a man who had made a decision he wasn't fully comfortable with and was now committed to it anyway because the alternative required admitting the decision had been wrong before it had produced its results. "Dr. Reach," she said, what is this?" "Mr. Morrow is a consultant to the hospital's institutional review committee," Reach said. "He has some concerns about last night's treatment procedures. He works for the people who made the compound." Reach's expression didn't move. I don't know what that means." "He just told me," Morrow said calmly. "I was being colloquial. I'm a private sector pharmaceutical researcher. I have interests in several compounds that the Defense Department is currently—" "I heard what you said." "What you heard was a simplification that I'm not interested in the revision." She kept her voice flat and even, and at a volume that didn't carry past the 3 of them. The lobby had other people in it. Day shift traffic, visitors waiting at the front desk, an orderly pushing a cart through from the far corridor, and none of them were paying attention, which she was aware of and intended to maintain. "What do you want?" Morrow looked at her with the expression of someone reassessing timing. He had expected the conversation to go in a specific direction, and it hadn't gone that direction, and she could see him deciding whether to apply more pressure or change the approach. He changed the approach. "I want to make sure that Captain Reardon's treatment is properly documented," he said, "and that the people involved in that treatment understand the full picture of what they're working with. His treatment is documented. The compound he was exposed to is proprietary." She looked at him for a long moment. "A proprietary chemical weapon." "I said compound. Captain Reardon is stable. His treatment record is accurate. The clinical documentation is complete. If you have concerns about the jurisdictional protocols, Colonel Steck is the appropriate contact." She stepped past him toward the exit. "Have a good morning." "Ms. Voss?" His voice didn't rise, but it changed quality, dropped into a register that was calibrated to land with weight. "The text you received this morning, that was a courtesy." She stopped, kept her back to him for exactly 1 second. Then she turned around. "There won't be a second one," he said. Still calm, still with the same measured patience of a man who spent his professional life in rooms where saying things quietly was more effective than saying them loudly. "The name Nora Calloway is in a file that does not need to become part of any public record. We would prefer that it doesn't. I think you'd prefer that too." Reach was looking between them with the expression of a man who understood he was standing in something much deeper than he had expected when he'd agreed to make the introduction. Nora looked at Morrow. "You should know something," she said. "Tell me. The last person who used that name as leverage, the last time someone tried to use who I was to manage what I do, is currently serving 22 years in a federal facility in Colorado." She let that settle for a moment. "Have a good morning." This time she didn't stop. She pushed through the lobby doors and walked out into the morning air, and she kept walking at a normal pace until she was around the corner of the building and out of the sightline of the lobby windows. And then she stopped and stood with her back against the exterior wall and looked at the sky and thought. She was thinking fast. Morrow knew her name. That meant whoever had sent the text had done a fast intelligence pull. Fast enough to go from the Trauma Bay event to a civilian alias breach in under 12 hours, which required resources that weren't casual. This wasn't a bluff from a pharmaceutical consultant with side interests. This was infrastructure. This was money and access and people who had been watching the DIA's medical roster for anything that matched a profile. They'd been looking for Variant 7 exposure response. They'd found her, which meant the facility Riordan's team had been targeting wasn't dark. It had eyes on Hargrove, which meant it had known about the extraction, which meant the 72-hour window Steck had described was already compromised. She pulled her phone, called the DIA routing prefix. Steck picked up in one ring. "You need to know something," she said.
But yet,
She was in Steck's temporary operations space, a conference room on the second floor that the DIA had commandeered from hospital administration and swept for electronic surveillance in the first 2 hours after arrival, which the hospital administration had been given no choice about accepting, within 8 minutes. Steck listened to everything without interrupting. When she finished, he was quiet for a moment. Morrow. Aldrich Morrow. Mid-50s, expensive coat, the kind of confidence that comes from never having operated in a context where the rules applied to him. "I know the name." Steck's expression had shifted into something harder and more deliberate. "He's been on DIA's watch list for 14 months. Private sector arms research with defense contract ties. Operates through 3 layers of corporate structure, all technically legal, all pointed at the same thing." He paused. "We didn't know he had presence here. He has reach. What does that mean specifically?" Reach made the introduction. He described Morrow as a consultant to the hospital's review committee, which is either a cover Morrow established in advance, or Reach has a relationship that goes back further than last night. She looked at the conference table. "My guess is he was contacted before the helicopter landed. Someone inside the facility knew about the extraction, knew where Reardon would be taken, and flagged Hargrove as the destination." Steck pulled out a phone and made a call that lasted 45 seconds and consisted mainly of him saying 2 sentences to someone on the other end and then listening. When he hung up, his jaw was set. "Reach has a consulting contract with Prentice Aldrich Biomedical, has had it for 7 years. It's in his financial disclosure, buried in the footnotes, attributed to Clinical Research Advisory." He put the phone down. "Prentice Aldrich is one of the 3 layers." The room was quiet. "He knew what compound it was," Nora said. "That's what I'm thinking. He obstructed treatment because correctly treating Riordan would have confirmed the compound's identity through the treatment protocol." She was working through it methodically, the same way she worked through a clinical picture, from symptoms back to cause, building the logic in the direction of evidence. If Riordan had died, the autopsy findings would have been ambiguous without someone who'd seen variant 7 before. The exposure evidence is in the treatment record now. The atropine timing, the pralidoxime response. Anyone who knows the compound knows those are the signatures. And now Morrow wants the documentation managed. He said the compound was proprietary. He used that word. Proprietary. She let the word sit there and mean what it meant. Steck stood up. "I need to make some calls that aren't going to be quick. You should not go back to your apartment." "I have a shift Thursday." "That's not what I mean." She looked at him. "I understand what you mean." Morrow sent a courtesy text. He doesn't send third contacts. The second contact is different. She had made this calculation already, in the 30 seconds between the lobby and the corner of the building. She knew what the escalation sequence looked like. She knew what came after a failed approach from someone who had infrastructure and no accountability and a reason to close information gaps quickly. "I'll stay in the building," she said. "That's not a great solution either. Reach has access. Reach has a problem now," she said. He made the introduction on hospital property in front of a federal patient's assigned medical staff. He's connected himself to Morrow in a way that's on security footage. She paused. He may not have thought that through. Steck considered this. Or he thought it through and decided the leverage on you was worth the exposure, which tells you how much Morrow is offering. The door of the conference room opened. One of the DIA staff agents came in with a tablet, showed Steck something on the screen. Steck looked at it for 4 seconds, and the expression that settled onto his face in those 4 seconds was the specific expression that meant the situation had just developed in a direction that was worse than the current trajectory. "Reardon's monitors went to alert 15 minutes ago," the agent said. Nora was already moving toward the door. The ICU had the controlled tension of a unit responding to deterioration, 2 nurses at the bay, the on-call intensivist coming through the unit doors from the other direction. monitors visible from the corridor showing the heart rate pattern that indicated the alert had been appropriate and wasn't resolving on its own. She went directly to the bay. The curtain was half open. Reardon was conscious, but his color had changed. The improvement she'd observed that afternoon was gone, replaced by a return of the gray undertone, and the monitor showed something she hadn't expected and should have: cardiac rhythm irregularity, not the clean sinus tash of early recovery. A pattern she recognized immediately as delayed organophosphate cardiac toxicity, the secondary wave that occurred 12 to 16 hours after initial exposure when the compound's metabolites reached the cardiac conduction system. She hadn't accounted for the modified synthesis. That was the thing about variant 7 being new. The modification affected the metabolic half-life in ways the standard nerve agent timeline didn't predict, and she had based her secondary assessment on the standard timeline, and that had been an error. She owned it without time to feel it and went straight to the monitor. "What are you seeing?" the intensivist said. He was young, late 30s, competent-looking in the harried way of ICU physicians who were always managing more than one crisis simultaneously. Delayed conduction toxicity, secondary to the primary exposure. She looked at the rhythm strip. The modification affects the metabolic clearance. He's not clearing the compound at the rate we projected. He's not in your care. He was. The ICU attending is Dr. Farrow. I know who the ICU attending is. Where's she? Procedure in Bay 7. She's been paged. How long? 4 or 5 minutes. Reardon's monitor alarmed. The rhythm changed from the irregular but functional pattern into something that had no business being on a cardiac monitor in a man who had been stable 40 minutes ago. The ICU nurses moved immediately, one of them calling out vitals, the other reaching for the crash cart with the practiced efficiency of people who had done this before. Nora looked at the rhythm, looked at Reardon. He was looking at her. His face had the focused calm of a man who understood what his own monitor was telling him and had made a decision about how to meet it. "What do you need?" he said. His voice was strained but steady. "Don't talk?" She turned to the intensivist. "Magnesium sulfate, 2 grams IV over 10 minutes. And I need lidocaine on standby. I cannot take orders from..." The rhythm is torsades, triggered by QT prolongation from the compound's secondary metabolite. Magnesium is the correct intervention, and the window is... She looked at the monitor. Narrowing. The intensivist looked at the monitor. He was smart enough to see what she was seeing and experienced enough to know that seeing it and knowing what to do about it were two different things. And what she was describing was specific and mechanistically coherent and matched what was in front of him. "Push the mag," he said to the nurse. The nurse pushed it. They stood in the taut silence of waiting to find out if they were right. 60 seconds. 90. The rhythm on the monitor wavered, held the irregular pattern, and then, gradually, began to resolve. Not immediately, not cleanly. It took 4 minutes, and in those 4 minutes, the room stayed at the particular pitch of clinical tension that didn't allow for anything other than watching and adjusting and watching again. At 4 minutes and 20 seconds, Reardon's cardiac rhythm returned to a normal sinus pattern. The intensivist exhaled. One of the nurses said something quietly to the other that Nora didn't hear. Reardon's eyes had closed. Not unconsciousness, she assessed, but the involuntary response of a body that had just spent significant energy surviving something and needed to stop spending energy for a moment. Dr. Farrow arrived at the bay at 4 minutes and 40 seconds, took a look at the monitor, looked at the nurses, looked at Nora standing at the bedside, and conducted the rapid situational assessment of an ICU attending who had walked into the aftermath of a crisis. "What happened?" she said. The intensivist explained, accurately and without editorializing. Farrow listened, looked at Nora. "You called torsades?" "Yes." "And the mechanism?" "Secondary metabolite affecting QT interval. The compound has a modified clearance profile. The primary treatment window is compressed, as I administered it correctly last night, but the secondary wave hits the conduction system in the 12 to 16 hour range rather than the standard 6 to 10. "You knew this." She paused for exactly 1 beat. "I learned it in the last 5 minutes. Farrow looked at her with the expression of someone deciding whether to push that or not. She decided not. I'll need a full consult note on the compound's cardiac profile. We need to restructure the monitoring protocol for the next 24 hours. I'll write it. You don't have ICU privileges. I'll write it and you'll co-sign it. Farrow assessed her for 2 seconds. Fine. The intensivist was already pulling the documentation up on the workstation outside the bay. The nurses were resetting the monitoring parameters. The ICU was returning to its baseline controlled chaos, absorbing the acute event and continuing to function around it. Nora stayed at the bedside for a moment after the others moved. Reardon's eyes opened. That was the second time today, he said. Don't make a habit of it. He almost smiled. The compound did something unexpected. The compound has a modified profile. I should have accounted for a larger deviation from the standard timeline. I didn't. She said it plainly, without softening it. I've updated the treatment parameters. He looked at her with the same quality of assessment she'd been on the receiving end of since he'd been conscious enough to look at anyone with intention. You just told me you made a mistake. I made an error in a novel situation and corrected it. Most people don't say it that clearly. Most people don't have the experience to know the difference between a mistake and an error in a novel situation. She checked his pulse manually. Old habit. Rest. She left the bay. Bakat. In the hallway outside the ICU, she wrote the consult note from memory. The cardiac mechanism, the modified timeline, the monitoring parameters Farrow's team needed for the next 24 hours. She wrote it on a clinical form and handed it to Farrow without preamble, and Farrow read it with the focused attention of someone reading a document that was unexpectedly dense with specific, correct information. Where did you train? Farrow said. Does it matter right now? Farrow looked at her over the top of the form. No, she said, and signed it. The hallway outside the ICU was quiet. Nora stood against the wall and looked at the ceiling and did the mental accounting that she had been postponing since the lobby, since the text, since the elevator doors had opened to Morrow's face. The situation had a shape now. It had been forming since 2:47 a.m. and was now fully legible. Not comfortable, not contained, but legible, which was what she needed it to be before she could decide what to do with it. Morrow had infrastructure, a hospital administrator in his pocket, and knowledge of her civilian identity. Steck had jurisdiction over Riordan, but not over the hospital, not over Reach, and not over whatever Morrow's network had positioned in the surrounding area. Riordan had 72 hours of critical monitoring ahead of him in a facility that was now compromised at the administrative level. And the documentation from the extraction mission, the synthesis records, the distribution network, the funding chain, was still in a facility that was aware it had been targeted. The arithmetic of the situation only produced one answer. She walked back to the DIA conference room. Steck was still there, on the phone. He looked up when she came in and finished the call. I'll do the consultation, she said. He was quiet for a moment. What changed? Nothing changed. She sat down. I ran the numbers and this was already where it was going. She looked at him. But I have conditions. Tell me. Reach gets investigated. Formally and now. Not after the mission, not as a follow-up. Whatever his relationship to Morrow's network is, it needs to be pulled before I walk out of this building, because if I'm going into a field advisory role, I am not leaving a compromised administrator with access to Riordan's care team. Steck nodded slowly. That's doable. It was going to happen anyway. I want it on record, not verbal. Fine. Second condition. Danny Reyes, the travel nurse who pulled the atropine last night. She gets protected. If there's any fallout from Morrow's network targeting this facility, she doesn't become collateral. She had no knowledge of anything. Agreed. Third. She looked at him steadily. When this is done, however it ends, Nora Voss goes back to Hargrove and nobody knows why she left or where she went. He looked at her for a long moment. I can protect the operational security. That's not what I asked. What you're asking is that we let you disappear again. I'm asking that you leave the choice to me. He was quiet. You saved Riordan's life twice today, he said. I know. That's not something that stays buried easily. That's my problem, not yours. He leaned back, looked at the table. I'll do what I can. It wasn't a promise. It was honest, which she respected more. Good enough. She stood. When do we leave? Transport is staged at the military airfield 40 minutes north. We can be wheels up in 3 hours. I need equipment. We have a full medical kit. Not what I mean. I need the full compound profile. Everything the DIA has on Variant 7's modified synthesis. If I'm going into a field position, I need to know the deviation parameters across the full toxicological spectrum, not just what I've inferred from treating one patient. Steck reached under the table and pushed a sealed file across the surface. She looked at it. You had that ready, she said. I had it ready before I landed at this hospital. His expression was the closest thing to an apology that a man like Steck could produce. I knew who you were before the helicopter touched down. One of the intelligence flags from the extraction flagged a civilian medical response matching Ghost Actual's field treatment signatures. I came here because I thought you might be here. He paused. I just didn't know if you'd help. She looked at the file, looked at him. I'll need appropriate clothes, she said, and coffee that isn't from the third-floor break room. He almost smiled. I'll see what I can do. She had 2 hours before transport. She spent the first 30 minutes reading the compound file, all of it, not skimming, absorbing the synthesis modifications and their downstream effects with the systematic focus she'd always brought to the intersection of chemistry and human physiology, the place where the distance between knowledge and outcome was measured in minutes. Variant 7 was more sophisticated than anything she'd encountered before the gap in her operational history, and the sophistication was in a direction that was specifically designed to defeat standard treatment protocols. The compressed primary window, the delayed cardiac wave, a tertiary neurological effect in prolonged exposures that the file flagged as incompletely understood. That last part was the part she spent the most time on. Incompletely understood in a compound designed for weapons application meant that whoever built it had accepted a degree of unpredictability in its effects, which meant whoever was using it was comfortable with unpredictability, which meant it was probably being used in contexts where precision wasn't the objective. That told her something about the distribution network she was going to help disrupt. She spent the second hour sending a message through the DIA's secure relay to Pharaoh, the full compound profile, redacted to remove classified details, but with the medical parameters intact, so Reardon's ICU team would have what they needed for the next 24 hours without her in the building. Pharaoh acknowledged it within 6 minutes. At the bottom of the acknowledgement she had written, "Whoever trained you, they did it right." Nora read that once and then closed the relay. She was in the corridor on her way to the temporary staging area when she turned a corner and found Reach standing in the hallway. Not Reach with Morrow this time. Reach alone, which was different, which carried the specific weight of a man who had separated himself from the strategy he'd been operating under and was now in the uncomfortable territory of individual reckoning. He looked at her with an expression that was not the calculated managerial authority she was used to, not the institutional performance. He looked like a man who had spent the last 6 hours arriving at the understanding that he was genuinely in trouble. Voss. He stopped walking. I know about Prentice Aldrich, she said. His face went through several things in rapid succession. Surprise, calculation, the specific panic of someone whose private information has just become other people's known information. And then went still. That's a consulting arrangement, he said. It's fully disclosed. In footnote language that describes pharmaceutical research advisory. She looked at him steadily. Morrow told me who he works for. In the lobby. On camera. She watched the camera detail land on his face. Whatever he told you about managing this, whatever he offered you, he put you on footage making an introduction on federal patient premises. The DIA has the security pull already. Reach said nothing. He looked like a man discovering that the floor he'd been standing on was not where he'd thought it was, relative to the ground. The investigation is already open, she said. What you tell them and when you tell them is still a variable. She paused. I can't advise you, but I'll say this once, Morrow will not protect you. He'll let you absorb the exposure and walk away clean, because that's what the infrastructure is for. She moved to go past him. Why are you telling me that? His voice was quiet. Not the practiced authority voice, the actual voice, which was smaller and less certain and sounded like someone who hadn't used it in a while. She stopped. Because I've spent 2 years watching you take credit for a unit that runs on the people you've been undermining, she said. And because being corrupt and being irredeemable aren't the same thing, and I don't know which one you are yet. She looked at him directly. But the window to demonstrate the difference is closing. She walked past him. She was 20 feet down the corridor when the hospital's overhead PA system activated. Not an alert tone, not a trauma activation. The flat automated tone of a facility-wide announcement, which hadn't sounded in the 3 hours she'd been in the building. Attention all staff and personnel. This is a security notification. The facility is entering modified access protocol effective immediately. All external access points are being secured. This is not a drill. All personnel remain at their current stations. She stopped walking. Modified access protocol was not standard Hargrove language. It was not any hospital language she'd heard in 2 years at this facility. She pulled her phone, called Steck. He picked up on the first ring. I was just about to call you, he said. We have a problem. The facility lockdown. It's not us. His voice had the specific edge of someone managing multiple inputs simultaneously and keeping their voice calm through discipline rather than because anything about the situation warranted calm. Morrow has people in the building. We identified 2 as of 5 minutes ago. We're working on getting Reardon moved, but the airfield transport is... A pause that lasted long enough to mean something. There's a vehicle blocking the staging access road. It's been there 11 minutes. She was already turning and walking back the way she had come. What's Reardon's current status? She said. Stable, but the ICU is in the secured zone. Once the access points lock, we have limited mobility in the facility. I'm going to the ICU. Nora, I'll need 2 things from you. First, get your agents to the ICU unit entrance and hold it. Second, whatever you need to do to get the facility lockdown overridden, start it now. The lockdown was authorized through the hospital's own administrative system. She turned the corner toward the stairwell. Which means someone with administrative access authorized it, she said. A pause. Reach, Steck said, or Morrow using Reach's credentials. She pushed through the stairwell door. How long to override? 15 minutes minimum? I've got about 10. She took the stairs at a pace that was slightly more than what the stairwell was designed to look normal in, phone still to her ear, moving with the specific economy of someone who had learned that running in a crisis was less useful than moving fast with a purpose that looked deliberate. She came through the 3rd-floor stairwell door at a controlled pace and turned toward the ICU. The 2 DIA agents were already at the unit entrance, which meant Steck had made the call before she'd reached the stairs. But between her and the ICU entrance, in the middle of the corridor, stood a man she hadn't seen before. Late 40s, nothing remarkable about him physically, the kind of forgettable appearance that was itself a professional tool. He was not in a hospital uniform. He was not in tactical clothing. He was in the same anonymous business casual as Morrow, standing with his hands at his sides and his attention entirely on the ICU entrance. He turned when he heard her footsteps. He looked at her. She looked at him. And in the particular quality of that exchange, 2 people recognizing what the other person was in the same instant, the situation that had been building since 2:47 a.m. arrived at the place it had been moving toward all along, and the corridor between them became the kind of space where everything that happened next was going to happen fast and without the benefit of institutional frameworks or security cameras, or the rules that governed what people were and weren't allowed to do inside a hospital. He moved first. She was already moving. And 30 feet from the ICU entrance, in a hospital corridor in the middle of the morning shift, the war that Aldrich Morrow had brought into this building came to its first necessary point of contact, and it did not look like what anyone watching from the nursing station would have expected to see between a man in a business coat and a woman in a nurse's scrubs, who everyone at Hargrove Medical Center had spent 2 years deciding didn't matter. He was faster than he looked. That was the first thing she registered. Not a threat assessment failure, because she'd clocked him as capable from the moment he'd turned, but a recalibration of the specific kind of capable. He moved like someone trained in close-quarters control, the kind of training that prioritized restraint over damage because the objective was to remove a problem from a space, not to produce evidence of violence in a hospital corridor. His first move was toward her right arm, a grab designed to redirect momentum, to spin her toward the wall, to create a situation that looked, from a distance, like a medical staff member being assisted rather than controlled. She let him get 2/3 of the way through it. Then she dropped her weight, rotated into the grab rather than against it, and used the leverage of his own extended arm to put him into the wall instead. It wasn't clean. She caught her shoulder on the edge of the nursing station counter, and the impact sent a spike of pain down to her elbow that she noted and set aside. He went into the wall at an angle and took the impact on his forearm and turned out of it faster than she expected, which meant the recalibration had been correct. He was operating at a level that most people in business casual in hospital corridors were not. The nursing station had one person behind it who had frozen at the first sound of impact, a hand covering her mouth. There were 12 feet between Nora and the ICU entrance. She didn't try to fight him for the corridor. She moved past him on his right, the side he'd taken the wall impact on, which was marginally slower, and hit the ICU entrance at a controlled sprint that put her through the doors before he'd fully recovered his positioning. The 2 DIA agents were inside the unit. The man from the corridor did not follow her through the doors. She understood why immediately. He'd had a specific objective, which was to prevent her from reaching Riordan, and the objective had failed, and a man operating under Morrow's infrastructure would understand that the ICU entrance with 2 federal agents was a threshold he couldn't cross without changing the nature of what was happening in this building, from covert pressure to overt action. And overt action had a different cost-benefit. She stood inside the ICU unit, breathing at a rate that was slightly elevated and declining, her left shoulder aching with the particular deep muscle pain of a blunt impact that was going to be significantly worse in about 20 minutes. One of the DIA agents looked at her. "You okay?" "Where's Steck?" "Second floor. He's got 2 of Morrow's people detained." "2." She looked at the agent. "How many did you identify total?" "2." There were at least 3. The one in the corridor, plus whoever Morrow had covering the administrative access for the lockdown, plus a driver for the vehicle blocking the staging road. She moved past him toward Riordan's bay. "Find the 3rd. Riordan was still in the bay, still on the monitors, still where she'd left him, which was what she needed to confirm before she could do the next thing. He looked at her when she came through the curtain, took in the shoulder she was favoring. The expression he produced was controlled but not entirely neutral. "What happened?" "Corridor issue. Resolved." She checked his monitors. Rhythm still clean, the cardiac parameters Pharaoh's team had reconfigured holding where they should be. "How do you feel?" "Like someone should tell me what's going on in my own hospital." "Not your hospital." "The hospital I'm currently wired to." She pulled up the medication record on the bedside screen, cross-referenced the last administered time. Everything correct. Pharaoh's team had been maintaining protocol. "Morrow has people in the building," she said. 2 are detained. We're working on a 3rd. The facility lockdown was authorized through administrative credentials, either reaches or accessed through him. Riordan was quiet for a moment. "And me?" "You're the objective. They want the mission documentation physically connected to a patient who didn't survive the exposure." She looked at him directly, "which means you surviving last night was a problem for them, and this morning's cardiac event may not have been entirely natural." The silence that followed had weight. "You think someone accelerated the secondary wave." "I think the compound's cardiac timeline matched the modified profile exactly." Which could mean the modification was specifically designed to produce a reliable secondary event at the 12-hour mark. In a patient who'd been stabilized, that would look like treatment failure rather than deliberate acceleration. She paused. "I can't prove that without the synthesis documentation." He looked at her. "Which is in the facility." "Which is in the facility." He breathed slowly. "Then we need the consultation to happen." "I know. And you need to get out of this building." "I know that too." She set the medication record down. "But not until the building is stable. If I leave with Morrow's people still mobile inside, Pharaoh's team is managing an ICU patient in a compromised facility without the compound information they need. You wrote the consult note." "I wrote what I know. What I don't know is the tertiary profile." She looked at the compound file she'd been reading, which she'd brought with her. "The file flags it as incompletely understood. After this morning's cardiac event, I think that's not an accident. I think the tertiary effect is understood by whoever made it, and the incomplete flag is deliberate obfuscation. She tapped the file. If there's a tertiary event and Farrow's team doesn't have the treatment parameters, you don't survive it. Reardon looked at the ceiling. I hate this particular kind of math, he said. Most people do, Des. Steck called her at the 40-minute mark. The facility lockdown had been overridden at 32 minutes, a federal judicial authorization that Steck's team had apparently had staged and ready in the event of exactly this kind of administrative obstruction, which told her something about how thoroughly Steck had anticipated Morrow's capabilities and how carefully he'd been unwilling to share that anticipation in advance. She noted that, filed it under things to discuss when this is over. The two detained individuals were in a second-floor conference room under DIA custody. Neither had spoken. Both had credentials that identified them as hospital compliance consultants, the same institutional cover that Morrow had used for himself, and both sets of credentials had the specific quality of documents that were real enough to have been processed through a real system, which meant Morrow had been building this infrastructure inside Hargrove for longer than 14 months. How long? She said, standing in the ICU corridor. Credential records go back 3 years, Steck said. One of them is on the hospital's formal vendor list. 3 years? Morrow's had a presence here since before Reardon's mission was even in planning. He paused, which means this wasn't reactive. He wasn't here because of last night. She understood it then, the full shape of it, the thing she'd been missing since the lobby. He was here because of me. Steck didn't answer immediately. The DIA has known about Ghost Actual's civilian location for 8 months, he said. There was a low-level intelligence flag, not from us, from a third-party source, that placed Nora Calloway at a medical facility on the East Coast. Morrow's network pulled the same flag. 8 months. We assessed it as low risk because you weren't operational. Morrow assessed it as an asset to be positioned against. A pause. I should have told you that earlier. I'm telling you now. She stood with the phone to her ear and breathed. 8 months. Morrow had been building around her for 8 months, positioning infrastructure in a hospital she worked in, waiting for a moment when the DIA's interest in her would create an opportunity to pressure her, to leverage the civilian identity she'd built against the operational history she was trying to leave behind. The text this morning hadn't been a response to last night. It had been a trigger they'd been waiting to pull. The third person, she said. We found him. Hospital services contractor. He was in the administrative system. That's where the lockdown originated. Is he talking? He is, actually. The quality in Steck's voice shifted slightly into something that was close to professional satisfaction. He rolled on Morrow very quickly once we explained his specific exposure under federal statute. What did he give you? Enough. Morrow's operational presence in the hospital, the compound's provenance. He can place it directly to a manufacturing network Morrow oversees through the Prentice-Aldrich structure, and the payment trail connecting Morrow to Reach. She was quiet for a moment. Reach. 7 years of structured payments through the consulting contract. But in the last 18 months, it changed character. The contractor has documentation showing Reach received payments specifically tied to intelligence about DIA patient intake at this facility. Steck's voice was careful and deliberate. Reach has been reporting federal patient admissions to Morrow's network for over a year. The weight of that sat between them. He knew, she said. Not a question. He knew Reardon was coming before the helicopter landed. The intake flag went to Morrow before the trauma bay team was assembled. She thought about Reach standing in the trauma bay. His specific objection to her treatment, the way he'd tried to remove her from the patient at the exact moment when the treatment window was most critical. He hadn't been protecting his authority. He had been running interference. I need to be in that interview room, she said. Nora. Not for Reach, for Morrow. She was already moving. He's still in the building? A half-second pause. He was instructed not to leave pending the federal jurisdiction assessment. Who instructed him? Hospital security. Hospital security that reports to hospital administration. She pushed through the stairwell door, which Morrow has had 3 years to work with. Morrow was not in the building. She had known it before she reached the second floor, the same way she'd known the cardiac event this morning had been too precisely timed, the same way she'd known the lockdown had been triggered from inside infrastructure that had been built with patience and planning. Morrow was the kind of operator who built exits into everything he constructed. He didn't stay in situations that had stopped being controllable. He'd identified the moment the third contractor was taken into custody. However he'd identified it, whether through a signal, a missed check-in, a timing protocol, and he'd moved. Hospital security had last seen him near the main entrance at 10:42. It was 11:07. The DIA team was running the outbound coverage now, vehicle registrations, transit surveillance, the standard net that caught people who moved too fast after a threshold was crossed. Whether it caught Morrow specifically depended on how well he'd prepared the exit, and based on everything else he'd prepared, she was not optimistic about a fast recovery. What was in the building was Reach. He was in his office on the fourth floor, which she learned from the DIA agent who had been keeping eyes on administrative movement since the lockdown cleared. He had not tried to leave. He had gone to his office and stayed there, which was either the behavior of someone who believed he was protected or someone who had decided the only remaining option was to stop moving. Steck came up alongside her in the second-floor corridor. "Federal investigators are en route," he said. "They'll be here in 40 minutes. Has Reach been told?" "Not yet." She looked down the corridor. "I want to talk to him before they arrive." "That's not Steck." She turned to look at him. "I am not going to interfere with the investigation, and I am not going to do anything that compromises the record. I want to have a conversation with the man who has been undermining my work for 2 years and who spent last night trying to let a federal patient die." She held his gaze. "Give me 15 minutes." He looked at her for a long moment. 12, he said. Reach was behind his desk when she opened the door. He looked up from something he'd been staring at on his desk. Not a screen, just the surface itself. The particular blank focus of a man who had run out of things to look at that made sense. He looked like the night had added 10 years to him, which she supposed it had. She sat down across from him. She didn't say anything immediately. He was the first to speak, which was how she'd expected it to go. "I didn't know he'd try to hurt Reardon." "What did you think he'd try to do?" "Manage the documentation. Keep the compound off the formal record. I thought—" He stopped. Pressed his fingers flat against the desk surface. "He told me it was proprietary research that the DIA was going to claim under federal jurisdiction without compensation to the research investors. He said it was an IP dispute." "And you believed that?" "I believed it was complicated." He looked at her. "I know how that sounds. It sounds like a story a man tells himself when he's decided not to look at what he's actually doing." His jaw tightened, but he didn't argue it. "The payments weren't for—" He stopped again. "I told myself the consulting contract was legitimate." "Was it?" He was quiet. "For the first 4 years," he said finally. "After that." He didn't finish the sentence. She looked at him. He was not a monster. That was the thing about sitting across from people who had done genuinely harmful things. They were almost never monsters. They were people who had made a series of decisions, each one easier than the one before, because the first decision had already moved the line, and the line kept moving, and at some point they were in a place they would never have agreed to arrive at if they'd been shown it at the beginning. That didn't make the harm less real. "Did Morrow tell you who Reardon was?" she said. "He said he was a patient connected to a classified mission with overlapping interests. His team was pulling documentation that would have ended Morrow's entire manufacturing network." She kept her voice even. "Morrow positioned you to obstruct treatment of a federal agent who was the primary evidence link to a weapons distribution program. That's what the IP dispute was." Reach stared at the desk. "I need to know if there's anything else," she said. "Any other patient? Any other intake flag? Anything you reported to Morrow's network in the last 18 months that involved federal personnel?" He looked up. "There was one other," he said. 8 months ago. A military patient, brief admission. I flagged the intake." He looked like the words were physical objects he was producing at a cost. "I didn't know what they did with it." "What was the patient's name?" He told her. She wrote it down. She stood up. The federal investigators will be here in 30 minutes, she said. What you tell them and how quickly you tell it is the last variable you have any control over. She looked at him from the doorway. Use it. She left the office and stood in the corridor and called Steck. I need a name run, she said, and gave him the name Reach had provided. There was a pause on the line while Steck ran it. The pause was longer than it should have been. Steck. I'm here. His voice had changed in quality. The name is in our system. What's the flag? Another pause. The patient flagged 8 months ago. He stopped. It's not a current flag. It's a closed record. He stopped again. Nora. The patient died 6 months ago, ruled as natural causes during inpatient stay. She stood in the corridor and held the phone and understood what she was hearing. Pull the treating physician record, she said. She already knew what it was going to say. She could hear Steck pulling it on his end, could hear the quality of the silence that preceded the answer, and she knew from that quality, from the specific texture of a man who had spent decades managing bad information, that the answer was going to be the one that took this from a corruption case to something else. Reach, Steck said. He was the attending. The corridor was quiet. Somewhere on the floor below, a door closed. Somewhere behind her, the ICU continued its rhythm of monitors and movement and the ordinary machinery of people fighting to keep other people alive. She stood in the corridor and held the phone and felt the entire shape of the last 24 hours settle into its final and most unpleasant configuration, the one where Callum Reach was not just a man who'd been corrupt for money and had made a terrible decision about an IP dispute, but a man who had possibly, with full knowledge, treated a patient in a way that ensured Morrow's network remained undetected for 8 additional months, while a name she didn't recognize died in a room on the 4th floor of this building. I'm coming to you, she said. 2nd floor, Steck said. She walked to the stairwell. The door had barely closed behind her when her phone buzzed with an incoming message. Not the DIA relay, not a contact in her phone. An unknown number, different prefix from this morning's text. She stopped on the landing, opened the message. It was a photograph. The photograph showed a document, a clinical record, the formatting unmistakable. The patient name at the top, the same name Reach had given her 30 seconds ago. The record had been altered. She could see the alteration. A medication entry, adjusted dosage timing, the kind of change that would have been invisible without the original for comparison. The message below the photograph said, I have the original, and 14 others like it. Meet me, or they disappear. The number was one she didn't have. The location pin attached to the message was inside the hospital. Morrow had not left. She looked at the location pin for 3 seconds. It placed Morrow on the ground floor. The East Wing maintenance corridor, the part of the hospital that ran parallel to the ambulance bay, the part that connected the building's utility infrastructure and was accessible from the interior without passing through any of the main staffed areas. She'd learned that corridor in her first month at Hargrove, the way she learned every building she worked in, not because she expected to need it, but because understanding the physical architecture of a space was a habit so old it had stopped feeling like a choice. She did not call Steck yet. She thought about why. The answer arrived quickly, and she didn't like it, because if Morrow had 14 altered clinical records and an original for comparison, those documents could disappear in the time it took to coordinate a federal response. Morrow had already demonstrated the speed of his exits. He'd also demonstrated that he understood leverage, and the leverage in the photograph was not leverage against her personally. It was leverage against the dead patient, against every case those records touched, against the possibility of any accountability that required those originals to prove the alteration. She texted Steck, Morrow still in building, East Wing maintenance corridor, ground floor. Give me 4 minutes before you move. She was already moving down the stairs. The maintenance corridor smelled like cleaning solution and recirculated air and the particular industrial neutrality of spaces designed to be functional rather than inhabited. Fluorescent strips ran the length of the ceiling, one of them flickering at the far end with the same malfunction the East Wing hallway had been carrying for 11 days. The floor was sealed concrete. Pipes ran along the upper walls. It was a long, narrow space with limited exit options, which told her Morrow had chosen it for a conversation rather than an escape. He wanted to talk, which meant the documents were real and he believed they were worth something. She walked in without slowing her pace. He was standing about 40 feet in, near a junction where two utility corridors met. He was alone, which she assessed and didn't quite believe. There was a door to his left that accessed the ambulance bay loading dock, which was one exit, and a door to his right that fed back into the building's service elevator bank, which was another. He had positioning. He had thought about this. He also looked like a man who had spent the last 2 hours managing a situation that had not gone the way he'd planned, which was different from the composed, patient version of him she'd met in the lobby. Not panic, but the specific controlled tension of someone operating past their preferred parameters. "No Steck," he said. "He'll be here in 4 minutes. Then we should be efficient." He reached into his coat and produced a phone, turned it so she could see the screen, the same photograph she'd received, plus a file icon beneath it. 14 records, a federal patient who died under suspicious clinical circumstances, plus 13 others across a 3-year period in 2 facilities. Reach is the attending on 6 of them. The others involve physicians in Morrow's network at a second location. He held the phone in a way that communicated he was prepared to do something with it. These go to a secure server or they go into a shredder. That's the actual choice right now. A secure server you control. A secure server that exists outside federal jurisdiction, which means the records exist as leverage rather than evidence, which is admittedly less satisfying for everyone. But it means they exist. He looked at her steadily. "If your people take me in the next 4 minutes, these files execute to a deletion protocol. The originals that prove the alterations are gone. The altered versions are what remains, and altered records of patients who are already dead become very difficult to prosecute." She looked at him. "You're telling me this because you want something." "I want the same thing I wanted this morning. Walk away from the consultation. Let Reardon's documentation stay in the facility. In exchange, the records go to a federal mediator of your choosing, unaltered, with the provenance chain intact. You're offering me evidence of your own network's crimes. I'm offering you accountability for Reach and the physicians in this network, in exchange for the operational documentation that would dismantle my manufacturing program." He was completely direct about it, which was, she thought, the most honest he'd been since the lobby. One for the other. She heard the stairwell door open at the far end of the corridor. Steck. Slightly under 4 minutes, which was about right. She looked at Morrow. "Here's what's going to happen," she said. Something in his expression shifted. A micro-adjustment. The recalibration of a man who had expected a negotiation and was now hearing something with a different shape. "Those records are going to a federal mediator," she said, "and you are going to be taken into custody. And the operational documentation from the facility is going to be recovered in the next 72 hours. She took 2 steps toward him. "Because you made an error." "What error?" "You sent the photograph to my phone." She pulled her own phone from her pocket. "The photograph contains embedded metadata from the device that captured it. And the message you sent came from a number that's been active for less than 24 hours, which means it was purchased recently, which means there's a purchase record tied to whatever identity protocol your network used to acquire it." She let that land. "Your secure server has an access log. Every time those files were opened, transmitted, or touched, that log recorded it. Your network's technical people are good, but Steck's technical people have federal subpoena authority, and the moment you transmitted that photograph to my phone, you created a jurisdictional hook that didn't exist before." Morrow looked at the phone in his hand. She watched him do the arithmetic. "The deletion protocol," he said, "might work or might not, depending on where the server physically sits and what mirror copies exist in the transmission record." She stopped 2 steps in front of him. "You're a man who builds exits into everything. What you didn't build into this one is the possibility that I'd let you think you had more time than you did." Steck came up behind her with 2 agents. Morrow looked at her for a long moment. Then he looked at the phone. His thumb moved toward the screen. The agent on Steck's left moved faster than the conversation had prepared Morrow for. The phone was out of his hand in one clean motion that had the practiced efficiency of someone who had been briefed on the deletion protocol risk and had come through the corridor door already prepared for it. Morrow's hand closed on empty air. He stood very still. "Aldrich Morrow," Steck said. You're being detained under federal statute pending charges that will be specified after we finish pulling everything you just handed us." Morrow looked at Nora. His expression was not rage. It was not the theatrical fury of a man whose plan had collapsed. It was something more honest than that. The specific, exhausted look of someone who had run a very long game, had run it well for a very long time, and had finally arrived at the end of the runway. "You could have walked away," he said. She looked at him without hostility. "So could you." The agents moved. He didn't resist. The next 6 hours had the quality of aftermath, the particular grinding, unglamorous machinery of consequence playing out across institutional and federal channels simultaneously, all of it requiring documentation, coordination, and the kind of sustained attention that was harder than the crisis that preceded it, because the adrenaline was gone and the work remained. The phone Morrow had been holding was in federal forensic processing within 20 minutes. The metadata pulled from the photograph confirmed what she'd told him. A device registered through a shell identity, purchased 48 hours earlier, with a transmission log that traced back through 2 relay points to a server location that the DIA's technical team had flagged within the hour. The deletion protocol existed. It ran at the moment the agent took the phone. It deleted 4 files. The server had 14. The mirror copies in the transmission record had all 14 plus 3 additional files that Morrow's team had not known were being captured by the relay infrastructure the DIA had had running on the building's network since the first hour after Reardon's arrival. Steck told her this in the second-floor conference room, and his expression when he said it was the closest thing to satisfaction she'd seen on his face since the trauma bay. "He built the network on infrastructure that overlapped with ours," Steck said. "Our relay was already capturing his traffic before he knew we were in the building. Because you staged the relay when you arrived. Because I staged the relay when I arrived." He looked at her. "Standard protocol. You didn't mention that this morning. You didn't ask." She looked at him. "Next time, mention it." He almost smiled. "Noted. The 14 records, the originals, unaltered, with the alteration comparison intact, went to a federal medical examiner and a designated federal mediator within the same afternoon. The patient who had died 6 months ago had a name. That name had family. The process of what came next for that family was not clean or fast, but it was now possible in a way it hadn't been that morning. And possible was not the same as resolved, but it was the necessary beginning of it. Reach was in federal custody by 2 in the afternoon. He had not waited to be asked. He had, by the account of the federal investigators who took his statement, begun talking before they finished explaining the charges, not in the way of a man performing cooperation, but in the slower, more difficult way of someone who had been carrying something very heavy for a very long time and had finally reached the point where carrying it was no longer possible. He gave them everything: the payment structure, the intake flags, the specific instructions he'd received regarding Reardon's treatment, the patient who had died. He had not administered the fatal alteration directly. The record showed that when the original was compared, but he had provided Morrow's network with the access and the timing that made it possible, and he had known afterward what had happened and had said nothing, and that silence was its own category of culpability. 6 other physicians across 2 facilities were named in his statement. 4 of them were taken into custody by the end of the day. The charges that came back, across Morrow, Reach, and the identified network, were not simple. They covered federal obstruction, conspiracy to interfere with a military medical operation, illegal research on controlled compounds, and, in the case of the patient who had died, a charge that the federal examiner described carefully and specifically as culpable negligence with evidence of coordinated concealment. Not murder in the simple sense. Something more institutional and more difficult and more accurately described by what it actually was. Nora did not watch any of this happen from a position of satisfaction. She watched it from a position of exhaustion and the particular complicated feeling of someone who understood that justice and resolution were not the same event, and that the documents that had been recovered were the beginning of a process that would take years and would be contested and would be painful for the family that had a name on a closed record, and that none of that erased the fact that the man was dead. She sat in the ICU family waiting room at 4 in the afternoon and felt all of that at the same time, without trying to simplify it. Danny found her there. She sat down in the adjacent chair without asking, which was the right call. She was still in scrubs. She'd been on shift through all of it, doing her job in a hospital that had been running a federal operation in its corridors, and she had the look of someone who had been processing information in real time that kept recontextualizing everything she thought she understood about where she worked. They sat in silence for a minute. "Is it over?" Danny said. "The acute part. And the rest?" Nora looked at the window. The afternoon light was doing the thing it did in late afternoon, coming in at an angle that made everything in the room look both warm and provisional, like the light itself wasn't committing to anything. "The rest takes longer," she said, "but it's moving." Danny nodded. Another silence. "I heard about Dr. Reach," she said. "Yeah. I filed 3 complaints last year about things he said to staff in the unit." She looked at the floor. "They went nowhere." "I know. Does that—" She stopped. "Will that matter now?" "It'll matter," Nora said. "Give them to the investigators. In writing, with dates if you have them." She looked at Danny. "Every single one." She went to see Riordan at 5. He was sitting up at 45 degrees now. A small thing, but a meaningful one. The body's vote of confidence in its own recovery. His color was back. Not fully, not the kind of color that said everything was resolved, but the gray undertone was gone, and what was underneath it was a person rather than a symptom. He looked at her when she came through the curtain with the expression she'd become familiar with over the last 20 hours, the one that was doing more assessment than it was showing. "Morrow's in custody," she said. "Steck called me." He watched her pull the chair. "How are you?" "I've got a bruised shoulder and I need about 12 hours of sleep." "That's not what I asked." She sat down. Looked at him honestly for a moment, which was harder than the previous 20 hours of looking at everything else. "I don't know yet. I'll tell you when I've had time to find out." He nodded. He seemed to understand that this was the actual answer rather than a deflection, and he didn't push it, which she appreciated. "The consultation," he said. "Steck has a team staged for the facility. They move in 36 hours. She paused. "With the documentation for Morrow's network, they have the synthesis chain now. The facility relocation won't help them. There's nowhere in the distribution network that isn't already flagged. So they don't need you." "They didn't need me for the consultation once Morrow handed them the network structure." She looked at him. Which he did, inadvertently, by trying to use it as leverage. Something in Riordan's expression softened slightly. Not a smile exactly. Something more tired and more genuine than a smile. "You knew that would happen," he said. "I knew what the metadata would show. I didn't know if the mirror copies were there until Steck confirmed it." She was honest about that. "The part where I told Morrow we had everything was partially a bluff." "How partially?" 60-40. He was quiet for a moment. Then he said, "I've been briefed on the patient who died. The name Reach gave you." She looked at her hands. "His name was Sergeant David Purcell," Riordan said. "He was 29. He was medically separated from service 8 months ago after a training injury and came to Hargrove for follow-up care." He paused. He had no family history of cardiac events. He died of what was recorded as an acute arrhythmia. She already knew this. She had read the file. Knowing something and hearing someone say it out loud were different experiences, and the difference had weight. "His mother has been told," Riordan said. "This afternoon. A federal liaison." He watched her face. "I asked to be told when it happened." "Why?" "Because he was a soldier who came to a hospital and was let down by someone who was supposed to take care of him." His voice was even, but there was something underneath it that was not even. "That's not something I can fix. But I wanted to know." She looked at him. There was something in this man that she recognized. Not from the mission records, not from the briefing file, but from the particular way he held difficult information without performing anything about it, without manufacturing an emotion for the benefit of the room. It was a quality she had respected her entire adult life in the people she'd worked alongside, a kind of structural honesty that didn't require an audience. Purcell's mother asked one question, he said. She asked whether her son had been in pain. She waited. The federal liaison didn't know how to answer it. They don't have the clinical background. He looked at her. Based on the record, based on what you understand about the compound's cardiac mechanism, was he? She thought about it carefully, not quickly, with the respect that the question deserved. The arrhythmia in the modified compound's profile, she said slowly, has a rapid onset. If the timeline matches what I'm seeing in the records, the interval between the initial event and loss of consciousness would have been short. Less than 2 minutes. She paused. I can't say it was nothing, but I can say it wasn't prolonged. Reardon nodded. I'll make sure that gets to her, he said. They sat with that for a moment. Then she stood up, and she didn't feel the clean relief of something resolved. She felt the complicated, honest weight of something that had been made as right as it could be, which was different and more human, and the only version of justice that actually existed outside of how people described it when they didn't want to look at it too closely. Get some sleep, she said. You too. She stopped at the curtain. Captain Reardon. Marcus, he said. She looked at him. Marcus, you're going to have a secondary cardiology follow-up before they discharge you. The tertiary neurological profile in the compound file. I've added notes to your chart. Make sure whoever does the follow-up reads them. I will. And make sure they read the whole note, not just the summary. Noted. A pause. Nora. She waited. Thank you. For both times. She didn't say it was nothing, because it wasn't. She didn't say she was just doing her job, because that was only part of it, and he would know it was only part of it. She looked at him for a moment with the honesty the moment required, and then she said, Take care of yourself, and went through the curtain, and this time she didn't look back. 3 weeks later, Hargrove Military Medical Center held a formal review, not a ceremony with flags and speeches. A review, the actual institutional kind, the one that was harder and more consequential and less comfortable than any ceremony, the one that required every supervisor who had looked the other way and every administrator who had processed a complaint into a drawer to sit in a room and account for what the drawer had been full of. Nora attended as a witness. She was not the only one. There were 11 nurses, 7 support staff, 3 physicians who had worked under Reach's department and had each, at different points over different years, filed reports that had not been followed. They sat in the same conference room in a row of chairs that was too close together and not close enough, and they each said what they had seen and what they had done about it, and what had happened when they'd done it. It took 4 hours. At the end of the 4 hours, the hospital's interim chief of medical staff, appointed after Reach's arrest, a woman named Dr. Elaine Sato, who had come from outside the facility specifically because the board had determined that internal promotion would look like exactly what it would have been, thanked each person by name, not as a performance. She wrote the names down, she read them back, she asked follow-up questions where the accounts were unclear, and she asked them with the seriousness of someone who understood that the record being created in this room was not a formality. When she called Nora's name, Nora stood and gave her account simply. What she had observed over 2 years, what she had reported, what had happened to those reports, and what had happened in the trauma bay on the night a federal patient had arrived and the system had tried to fail him. She did not dramatize it. She did not minimize it. She said it exactly as it had been. Sato looked at her when she finished. The treatment you administered on the night of the incident has been reviewed by a panel of 4 independent physicians specializing in toxicology and emergency medicine. Their finding was unanimous, she paused. Every clinical decision you made was correct. Not adequate, correct. And the subsequent interventions the following day were described as, and I'm quoting the panel, demonstrating a level of compound-specific knowledge that exceeded anything in the existing published literature on this agent. Nora sat with that. The hospital formally acknowledges, Sato said, that the systemic failures that allowed Dr. Reach's conduct to continue unaddressed created an environment where qualified staff were suppressed, patient safety was compromised, and at least 1 patient death may have been preventable under different circumstances. She looked around the room. That acknowledgement is in writing. It will be part of the permanent institutional record, and it is paired with a formal policy restructuring that goes into effect Monday, covering complaint protocols, supervisory review, and staff advocacy procedures. It was not enough. Everyone in the room knew it was not enough. The man named David Purcell was still dead, and the acknowledgement didn't change that. And the policy restructuring didn't reach backward. But it was the start of something being done correctly, which was different from nothing. And in the specific grammar of institutional accountability, different from nothing was the best available outcome, and it mattered that it happened. After the review, Danny caught up with her in the corridor. "The complaints I filed last year," Danny said. "Sato's office called me this morning. They're being formally reopened." "Good. All three of them." She looked at Nora with an expression that was trying to hold several things at once, relief and anger and the complicated gratitude of someone who'd spent a long time not being believed and was still adjusting to the reversal. "I don't really know what to say." "You don't have to say anything." "I want to say something." She stopped walking. "You spent 2 years in this building being treated like you didn't matter. And you—" She stopped again. "You still showed up every night. You still caught the things other people missed. You still protected patients that nobody was going to thank you for protecting." Nora looked at her. "That's the job," she said. "No." Danny's voice was quiet but certain. "Other people did the job. You did something else. You did the job knowing nobody was watching, and it still counted to you." She shook her head slightly. "That's not standard. I want you to know that's not standard." Nora stood in the corridor of a hospital she had spent 2 years becoming invisible inside, and she heard what Danny was saying, and she let herself hear it without deflecting it or diminishing it or tucking it into the organized interior space where she put the things she wasn't ready to feel. She just let it be true. "Thank you," she said. She didn't go back to being invisible. That was the thing she understood in the weeks after. Not suddenly, not in the clean way that realizations happened in stories, but gradually, in the way things were actually understood, through the accumulation of small moments that kept pointing in the same direction until the direction became undeniable. She stayed at Hargrove. She kept her shifts. She kept her name, Voss, the name she'd chosen for this life. And she kept the apartment with the window that looked out over the ordinary street. And she kept the routine of the work that had always been the truest version of who she was underneath everything else. But she stopped managing her own edges. She stopped pulling back from decisions to let someone louder have the space. She stopped filing reports and watching them disappear and telling herself that the system's failure was something she was navigating rather than something she had a responsibility to contest. When she saw something wrong, she said so. Not loudly, not with the performance of someone who had something to prove, but directly and specifically and on the record, the way she'd been trained to do in contexts where being on the record was the difference between accountability existing and accountability being someone's word against someone else's. Reardon was discharged on a Tuesday. He walked out of the ICU under his own power, which the cardiology team had determined was safe only that morning after a final round of monitoring that had made everyone nervous for about 20 minutes, and then settled into the clean pattern that meant the compound had cleared. He looked like someone who had been very sick and was now the specific version of well that meant the body had fought hard and won at a cost. He stopped at the nurse's station on his way out. He looked for Nora. She was at the end of the corridor coming back from a patient room, and she saw him before he saw her, saw him standing at the station with the particular stillness of someone looking for a specific person, and she felt something she hadn't expected to feel, which was the simple human quality of being looked for. She walked toward him. "You're leaving," she said. "Cardiology cleared me 20 minutes ago." "I know, I read the final note." He looked at her. "How's the shoulder?" "Functional?" "That's not quite the same as fine." "No," she agreed, "but functional is what I have." He was quiet for a moment in the way that meant he was about to say something that required the moment to be right. "The facility operation concluded yesterday. The synthesis documentation is in federal custody. The distribution network is being dismantled across 4 countries. He held her gaze. "Because of what happened in that trauma bay 3 weeks ago." She didn't say it was nothing. She'd stopped saying things were nothing. "Good," she said. "Steck wanted me to tell you." He paused. "Actually, Steck said he'd call you himself, but he won't, because he's already on to the next thing and that's how he operates. So I'm telling you. The name Ghost Actual is going back in a classified file. Nora Voss is a nurse at Hargrove. That's the record. She nodded. And the other thing. He pulled something from his jacket pocket. A small card, plain, with a phone number on it. Nothing else. If you ever decide you want to consult again, not full-time, not what you were, just if there's something that needs someone who's seen what you've seen. He held it out. No pressure attached to that. She took it. She looked at it for a moment. Then she looked at him. Take care of yourself, Captain. Marcus? Marcus. A pause. Take care of yourself. He did almost smile the same way he had before. You too, Nora. He walked toward the exit. She watched him go. Then she turned and went back to work. She did not stand at the window feeling transformed because that was not how transformation worked, not the real kind. The real kind was smaller and more durable than that. It was the decision, made quietly and without witnesses, to stop treating your own capability as something that needed to be managed for other people's comfort. It was the understanding that the years she'd spent trying to be smaller hadn't actually made her safer. They just made the space around her emptier than it needed to be. It was the recognition that the woman she'd been before and the woman she was now were not two separate people she had to choose between, but the same person at different distances from herself. She had spent 2 years hiding the thing that made her effective. She had spent 2 years believing that the way to survive an institution that undervalued her was to give it less of herself to undervalue. She had been wrong. Not entirely. The caution had been real, and the reasons for it had been real, and she didn't discard them. But caution and invisibility were not the same thing, and she had confused them, and the cost of that confusion had been paid in part by people she couldn't get back. That was the part she would carry. Not as damage, as information. She walked back into the ward and picked up the next chart and began her assessment with the focused, unhurried attention of someone who understood that the patient in front of her was the whole of the present tense, and that the present tense was the only place where any of the things that actually mattered ever happened. The monitor at the nurse's station beeped once, routine. The hallway settled into its rhythm, and Nora Voss, who had once been someone else and had become herself and had learned at considerable cost that these were not mutually exclusive, went back to doing the work that had always been the truest expression of who she was, not in spite of everything she'd survived, but because of it, and for the people in the rooms around her, and for the ones who came after, and for the simple and undecorated reason that she was good at it and she was still here. And that was enough. That had always been enough.